Why is it important to complete a readiness assessment prior to starting an exercise program? It lets you see where you're starting from. It can certainly be a reality check. It was for me. It is important to check with your doctor if you're unsure. I want to build on a strong foundation and become more physically fit. I do not want to risk injury from attempting things I am not physically ready for. Why is it important to assess your beginning fitness level? You want to be able to figure out what your strong points are and what your weak points are. If you do not measure this from the beginning, you will have no idea how much progress you're making. What were your results? I walked for 1 mile at the gym. My daughter kept track of the laps, 21, and the time on the stopwatch setting on my cell phone. I walked the mile in 15 minutes and 32 seconds. My pulse rate was 136. How do your results compare to other individuals within your range? I scored average. I'm not convinced that the results are 100% accurate, though, because I take a beta blocker for my blood pressure, which means my heart rate might be artificially low. Were you happy with these results? Why or why not? I'm not really happy with the results. For one, I thought I was a little more above average with my fitness. I also now realize how much work I have to do to get in better physical shape. Whether you are happy with your results or not, identify 3 ways you could improve your results. I need to get moving every day. I am making a commitment to stop at the gym on my way home from work. I need to set goals and hold myself accountable. On my days off, I need to be more intentional about getting my 30+ minutes of exercise done. I already eat healthy. I will continue to eat to nourish my body, not to feed my sugar addiction. How does a lifestyle factor of physical fitness affect overall health and wellness? In Chapter 1 of our text, it stated that healthy lifestyles that involve diet, physical activity, and personal health habits offer the most potential for preventing health problems or delaying them until much later in life. It even listed physical activity as the #1 leading health indicator for healthy people. How do these results relate back to your physical wellness results from week 1? I did a little better in this test than I did in my physical wellness assessment. I got a 64, which is below average. Since then, I have been more intentional about exercising. I guess I'm in the preparation stage. I am active in making small changes, but not yet meeting the physical activity guidelines. I'm really working on that. Which other dimensions of wellness does physical wellness affect, and how? Physical wellness affects every other dimension. Spiritual wellness, it is extremely hard to have serenity and peace when your body no longer works the way you want it to. Emotional, it is very easy to become stressed and depressed when your body is combating illness and disease. Occupational, some conditions, like out-of-control diabetes or advanced COPD, make steady employment impossible. Intellectual, I would hate to have complete use of my mind, yet be unable to do the things that bring me satisfaction, like working with my hands, taking care of my animals, and being able to get out of bed because I had a stroke or a heart attack. Social, I get very sad when I see patients in nursing homes and no one visits. It is sad when the highlight of their week is when the medics come to take them to dialysis. Environmental, if I was not physically well, I could not recycle, and I definitely would not be able to drive my recycling into the facility in town. I probably would care a lot less about the environment. Thank you.